There are many challenges in healthcare, particularly in underserved areas. Stay with us as we talk about how to provide good quality care when you have limited resources.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to this segment of Kentucky Health. Today we want to talk about rural healthcare, particularly what are some of the special problems, opportunities, and the ways we can solve those problems. With us today is Mr. Walter May, who's President and CEO of the Pikeville Medical Center. Mr. May, thank you for being with us.
Well, thank you for inviting me on your program.
Oh, I'm glad to have you. Now, let's talk a little bit first about Pikeville Medical Center. Tell me, how did this institution get started? Because it seems like when looking back, you have private hospital, and then you have something with United Mine Workers coming together to forming an institute.
Well, let me give a little bit of the history. This hospital was formed back in the early 20s. In fact, it's about 90 years old. It was originally put together by a bunch of local businessmen. They couldn't get it off the ground, and they were able to get the Methodist Church to come in and sponsor the hospital. And for about 80-some years, we were associated with the Methodist Conference and was a Methodist hospital. A few years ago, we were separated from them, and it's run as an independently local community-owned hospital now, not-for-profit.
What about the relationship to that special population of mine workers? Was that something at the very beginning planned out, or just worked that way?
Okay, well, at one time there was two hospitals in Pikeville. There was the United Mine Workers Hospital. They built a bunch of hospitals in the mine fields to serve their population. And then the Methodist Hospital. The Appalachian Regional Hospital chain come in and bought the miners' hospitals and took them all over. Then we purchased the Pikeville Hospital from ARH, and that's how we ended up with just one hospital in Pikeville.
Now, I said in the beginning that this area where Pikeville is sitting is established as an underserved, at least medically speaking, underserved area. Is that a fair assessment?
Well, the area is underserved. Pikeville and Pike County is not typical of the rest of eastern Kentucky. You're going to find that the economy here stays stronger than it does in the rest of eastern Kentucky. It's there's a lot going on in Pikeville. We have the third largest banking center that's located here. Right. You've got Louisville first, Lexington second, and Pikeville. It's sort of the hub for this region, for this part of eastern Kentucky and parts of Virginia and West Virginia, for retail, for educational, for health, and legal. We have a federal courthouse here. It's just a lot of reasons for people to come to Pikeville.
What about in terms of your catchment area? Now, is it just Pike County, Floyd counties, or?
No, we're serving an area now out of about 100 miles. We made a real change in how our hospital was run back in 1990. Mm-hmm. Prior to that time, you could go back and read the history of this hospital by reading the minute books of the board of directors, and you'd find that almost every meeting was primarily the same. How are we going to pay for this? How are we going to meet payroll? We were a struggling, sleepy acute care hospital. Mm-hmm. In 1990, we made a change. And it all come about, I think, from a story that I told the board. And traveling to Lexington, which, we go there quite often, I have friends there, and it is a larger trade center. And I would notice a lot of ambulances on the Mountain Parkway. Mm-hmm. And my first thought, as you met all those ambulances, was, I sure hope that poor soul in the back of the ambulance makes it. Then as I would take a closer look at my rearview mirror as it went by, the ambulances were about the same size of an armored truck. And I think that's like an armored truck full of money leaving eastern Kentucky and going to central Kentucky. Now there's only, I believe, 5 hospitals in Lexington, only 1 hospital in Pikeville. And yet if you take a pen and put it in the map of Pike County and the courthouse and draw a line, say maybe 50 miles out, check your population, do the same thing with the Fayette County courthouse, you'll find the population varies very little. See, in Lexington, everybody lives in the city, and there's very few people lives out in the rural areas. Here it's just the reverse. The city's very small, but the rural areas are heavily populated. And we're surrounded by a lot of large populated counties in Kentucky and Virginia and West Virginia. So we just, instead of being a hospital that just patched up the patients, sent them on to a specialist, we made the decision that we were going to hire our own specialists and treat the people here. Not only was it better for the families, better medicine, a lot of those people didn't make it on that long trip down the Mountain Parkway. So we made that change then. It's been working real well. We have all the major specialties covered now. And we started with heart, but we've got neurosurgery and got so many that I hesitate to try to mention because I'm sure I won't forget some of them.
Well, let's talk a little bit about that emergency factor. Now I understand you've just had some, just redone your emergency room.
We just spent $10 million and updated our emergency room and enlarged it. Very modern, very up to date.
What was the impetus behind that? Was it just to try to keep some of those patients from in emergency situations
it was just too small to handle the number of people. Our emergency room is busier than at times than the UK Med Center. There's a lot of people comes here. In fact, we hope to by October of this year to become a trauma center.
I was going to ask because I would imagine with the way the mountain roads are, pretty slippery, a lot of accidents. Plus, shooting sports are very popular around here. Imagine getting some accidents with that.
Well, there's times that even helicopters can't fly because of the weather's too bad. So we know we have saved lives by people being able to stay at home.
So what level do you think you're going to be moving up in this trauma?
I always get it confused as to where the 1, 2, and 3, which one's the highest. I think 3 is the highest. We're going to start out as a level 2 trauma center.
Okay. So that should be very interesting around here. You mentioned something about cardiac problems around here. Now, in eastern Kentucky, when we look at the biggest disease problems, there's heart disease, or really you can go from coronary artery disease, hypertension, then diabetes, which probably affects those 2, and then cancer. What is it that you're doing to try to affect some of the cardiac problems around here?
Well, we have one of the best equipped and best staffed cardiovascular departments you'll find anywhere. All the latest equipment, some of the best doctors, and we also do a lot of preventative medicine of telling people, about the advantages of to stop smoking. We became a smoke-free hospital, and probably one of the first in the state of Kentucky before the Joint Commission ever required us to do so. And in fact, we don't even allow smoking on our campus anywhere. You have to get off our property to smoke.
When you start talking about preventive activities, are you trying to reach out into the community beyond just the hospital itself? Yes,
we do. We run free screenings for cancer. We run free screenings for just about everything at one time or another at different parts of the county. Back during the recent flu outbreak, we were I believe the only hospital in the state to do free flu screenings away from the hospital. And you say, well, why do it away from the hospital? You don't want to be bringing all that flu into the hospital.
That's a good point. That's a good point. Regarding other problems, though, because it's so treacherous as far as traveling around here, inclement weather, do you have outposts of the facility in other areas around the surrounding counties?
We do some clinics in Whitesburg and Prestonsburg and Williams, West Virginia. Yes, we have some.
So those tend to all bring patients back in here. Now, you also recently have an affiliation with the Cleveland Clinic. How does that work?
Well, it all come about by our mode of operation here. All hospitals compare themselves with their performance numbers, but generally with like hospitals and like communities. We started a number of years ago of comparing ourselves with the best in whatever field it was we were wanting to benchmark with. For example, we were comparing ourselves with Cleveland Clinic with heart, MD Anderson with cancer, and Mayo Clinic with neurosurgery, and most everything else. And through that relationship and the conversations we had with Cleveland, we found that they were open to an affiliation. And it's only with our open heart program. Our doctors are credentialed in Cleveland. They meet by teleconferencing. I believe it's once a week, I think, with the Cleveland doctors to talk about their cases. We send staff there to be trained, and our doctors get trained in the latest techniques.
What impact has that had on the health of people in this area?
Oh, it's been tremendous already. We've seen a dramatic increase in people coming here for heart problems because of our affiliation with Cleveland. Our goal is to mirror the way that Cleveland treats their patients, and with the hope that if we do so, that we'll have the same outcomes as you have in Cleveland. And I can already see improvements.
I wonder, are you also going to emulate the clinic in terms of some of the other centers of excellence there in colon and rectal surgery, neurology?
I would think that it would be something that we will either do with Cleveland or with other centers, like I mentioned earlier.
Now, one of the problems of rural healthcare is trying to retain physicians in these areas. Are you finding that to be a problem?
Not at all. I was told when I set out on this plan, of moving toward becoming a tertiary care hospital, that it was going to be impossible to find the specialists to move their families and come to Pikeville. We haven't found that to be a problem at all, and we don't have any problem with retention. Very low turnover. And the reason for that is pretty simple. If you take a close look at our hospital, we have the best equipped hospital that they're going to find anywhere. We have the latest technology in every area that you go into, and doctors like that. And Pikeville is a good community to live in. And we do our own recruiting. We don't depend on headhunters to recruit for our physicians.
Do you foresee a time, there's a trend that's going on now where hospitals are purchasing or merging with physician practices? And there's some good points, and I think there's some bad points with that. Do you see yourself getting into that position?
Well, no, but we're doing our own thing. It might surprise you that we are.
Not surprised now, sir.
We don't buy physician practices, and we don't merge them. Now, we do hire physicians. We've got around 300 physicians that are credentialed at this hospital today. Out of those 300, about 100 of them are employed by the hospital. We employ physicians, but we don't buy their practices. It just doesn't make any sense. Business sense to me. And I've found that of the new doctors that we talked to about moving to Pikeville, practically none of them want to go into private practice. They don't want to do that anymore. It's too difficult. And they want somebody to run their practice. They don't want to have to deal with all the federal regulations. They want to practice medicine. We provide all those services.
Do you see that as providing a greater cooperation then between what the hospital is trying to do and what the physician is trying to do?
Absolutely.
So everybody's on the same page at the same time?
Absolutely. Many, if not most, of our local docs have contacted us. They want to go to work for the hospital, and I'm sure that in the foreseeable future, over the next 4 or 5 years, probably most, if not all of them, will.
What is your relationship with the Kentucky School of Osteopathic Medicine?
Well, we were one of the original supporters and founders of it, and made a substantial financial contribution to the college to see them do that. And we have their residency program, and I think we get more of the residents than any other hospital, and we probably hire more of them than any other hospital. They've been open long enough to where we're beginning to see the effects of doctors coming back here. It was originally put in, and still their main emphasis at the college is to train family practitioners and hope they will stay in the area. But a number of them are going on and becoming specialists. And we just hired a cardiologist away from Cleveland, the Cleveland Clinic, that they got their medical education at Pikeville College. They got their training at Cleveland. Cleveland hired them, and now they want to come home, so they're coming here.
One of the other challenges when looking in rural communities is that there's a heavy population of Medicare and Medicaid patients.
We have that.
Is that a problem as you're looking toward providing resources, funding, so you can have the resources to provide good quality care?
Yes, it would not be fair to say it's not a problem. Start with Medicaid never pays you your full charges, or you're being paid by Medicaid, but less than what it costs you to do it. Medicare is always changing their reimbursement policies almost on a monthly basis, so you never know what you're going to be getting. But somehow, with the addition, I think, of our specialists, we're pulling people in from other states, West Virginia and Virginia, and some from Tennessee. In fact, we have patients that come here from Lexington that are coming to our hospital. So we're getting enough of the people with good insurance to make the hospital profitable at a time when other hospitals are struggling, and most of them are. And we are forging ahead. We're not laying employees off, as you read to most hospitals. We're still hiring. We have over 2,000 employees, over right at 300 doctors. We're still recruiting for doctors, and we're still profitable and doing quite well.
So you're retaining the employees that you have,
Yes.
in addition to bringing on new people? What does that mean to you in terms of providing quality care, that you still have employees that have been around for a number of years?
I think it means everything. We really stress in how we treat our employees. We were picked by Modern Healthcare Magazine as the 7th best healthcare facility to work for in the United States. We've been picked as #1 in Kentucky of all hospitals. And what that means is you've got employees that like their jobs. They don't dread coming to work. They look forward to it, and they therefore do better work and gives you better health care.
Tell me about what something like the American Alliance for Healthcare Providers naming you National Hospital of the Year.
2 times.
2 times. Forgive me, sir. I'll say it twice then. The American Alliance of Healthcare Providers being awarded 2009, 2010, 2010, 2011.
I like to hear that.
I bet. What does that mean to you?
That's meant a lot to us. It's a confirmation of what we were trying to do, that tell us that we are being successful in what we've set out to do. Our mission statement here is to provide quality regional health care in a Christian environment. And when you have these outside groups come in and confirm that you are doing what you said you would do, it makes you feel very satisfied and very happy.
Now, cancer is a big problem throughout the entire Commonwealth, particularly big out here in eastern Kentucky. You now have the Leonard Lawson Cancer Center. How did that get started, and what are the goals there?
Well, we've been the leading cancer hospital in eastern Kentucky. I can't recall how many years, but it's been a long time. Even before we had the Leonard Lawson Cancer Center, Mr. Lawson made a generous contribution to the hospital, and so we named the cancer center after him. But again, I've got to brag about our people there, our oncologists. I think we have 7 oncologists, and we've just bought 2 of the latest linear accelerators that is available. The same things that MD Anderson uses. They're about $10 million a piece. It's quite an investment in cancer, and we have a lot of cancer patients.
Do you still have any special relationships with mines, some meeting the care of the mine workers, since it's still big coal country around here?
Of course, we have a lot of miners that come here, but it's not the major part of our business that it used to be. In fact, the University of Kentucky did a survey recently, within the last couple of years, that probably would surprise a lot of people, that the #1 industry in Pike County is not mining; it's healthcare. It has become the #1 industry, and in fact, a lot of people say, well, you got a big hospital in a town the size of Pikeville. It's probably easy to understand, but most people are not aware that the healthcare industry in Lexington is much larger than the horse industry, or IBM, or Lexmark, or whatever they call it now, but of any of the other signature industries you have there. It's a big industry everywhere, and it's
well, yes,
the same here.
because we're getting older. Healthcare is becoming
Yes.
a far more bigger problem. What do you do for the patient when it's time to transition from the hospital? Are you getting into the rehab facilities?
Yes.
Or do you have relationships there?
Yes, we do. We have a hospital within a hospital. We have the top floor of the May Tower that is a rehab hospital, and we also have outpatient rehab. facilities across the street here. When you come in or leave, you might see them. Also, we do home health with rehab, sending people to people's homes.
Now, coming in here, you mentioned as one comes in here, you can't get into Pikeville Medical Center easily. You have more construction going on than
that's
Long
because of the
House.
Construction. Yes.
Now, tell me about this. What are you doing out here?
We are we were just getting covered up with cars. Didn't have enough space to park the cars. Still don't have enough space. So we're building a 11-story parking building that will park over 1,000 cars here in front, as well as a physician's office building and additional areas for surgery. It's about a $100 million expansion program.
So that physician's office building, you trying to bring all the physicians to be on campus so
Yes.
they can be right here close to the facility?
Yes.
What do you see that doing for the docs?
I think it's going to do a lot for the doctor and do a lot for the patient, so that it's kind of a one-stop shopping center. You pull in the parking building and leave your car, and regardless of what the weather is, and make it to your doctor's office. If you need tests, they can all be done here, or if you need admitted to be the hospitals. But for the doctor who has patients in the hospital, if one of his patients needs to see him and he's doing office hours, instead of making everybody wait, he can just walk down the hall, see his patient, come back.
You know, one of the things that's often been said about the physician practicing in rural areas is that there's a sense of loneliness because there's not that collegial relationship. Sounds like you've solved that problem by having everybody right there where you can have this communication.
I think we have. I think most of the things that people think about Eastern Kentucky is not, and healthcare problems are not the same as it is in Pikeville in the area. It's changing fast. We've made some great strides.
You're comfortable with the way things are going?
Yes, I am. The only thing I'm uncomfortable with, and our problem that we have, is that we're getting so many patients and we're growing so fast, it's hard to keep up with. But that's a good problem to have.
What is the long-term vision that you see for providing health care here in Pikeville? What's it looking like?
Well, I'm going to tell you, but you'll probably not think that I'm serious. I want to be another Mayo Clinic, and I think we can be. I'm very familiar with the history of the Mayo Clinic and how it was formed and what it is today. At the juncture of the Mayo brothers and Rochester, they were not as far along as we are now. After we've set this program, it's doable. And Rochester was not a town any larger than Pikeville, Kentucky. If you build it, they will come.
I'm going to correct you on one thing, though, sir. I'm a
What's that?
Cleveland Clinic trained man. If you want to reach for the top, you want to be like the Cleveland Clinic, not the Mayo Clinic. Let me ask you a question now. As you're driving down the Mountain Parkway and you look in your rearview mirror, which way is that ambulance going now? Sounds to me that ambulance is coming down to Pikeville.
You're seeing them coming this direction. You just don't see as many ambulances on the parkway anymore because they don't have any reason to be down there.
I think they're in your rearview mirror heading down as opposed to coming
As you
out
get
this way.
closer to Lexington, of course, you get into that area, then they're going that way. But about 100 miles out, they're coming this way.
Is there any service that you don't provide out here?
Yeah, there's a couple of things that we are light in, that we're still recruiting for, and physicians that we maybe should have more doctors in that specialty.
Is this the model for a regional medical center in the
Yes.
Commonwealth, what you're doing down here now?
I would think so. You know, you talk about all the mergers and reading about all the hospitals going together because they can't make it stand alone and strength in numbers. I've always told everybody I don't want to have the largest hospital in the state. I want to have the best hospital in the state. And if you concentrate on quality, I believe the business will take care of itself.
You know, in the long run, as we talk about quality health care, I think you're right, Mr. May. It's not about the size, but rather it's what it is that you're doing and the coordinated care that's being provided between the physician staff, nursing staff, ancillary staff, and what goes on as far as hospital administration. I can tell you, if you look at the things that are going on down here in Pikeville, clearly they're doing it the right way. This is a wonderful environment in which to practice. As we talk to the physicians that are down here, good quality care being provided for good people. As we look at the problems that are happening in rural health care, this is the place where people are going to want to come and be taken care of well. If you have any questions about this particular show, feel free to contact us at Kentucky Health. You can reach us at kentuckyhealth@insightbb.com. Of course, if you'd like more information about the Pikeville Medical Center, feel free to contact them. I'm sure Cindy Johnson down in Public Relations will be more than happy to hear from you. Or you can even try to reach Mr. May himself if you can pin him down. I wish you good luck with that.
He was just man in Pike County to locate.
I bet you listen to him on the radio. This is Dr. Wayne Tuckson. I'd like to thank you very much for being with us and look forward to seeing you again on another segment of Kentucky Health.
And thank you.
Thank you.
Cause I can see you're from Kentucky too. Now do you bleed red or do you bleed blue? Corvettes and gold cars to riverboats, Patty Lovelace to J.D. Crowe, barbecue, burgoo, and bourbon balls, from the land between the lakes to the Cumberland Falls. There ain't nothing like my old Kentucky home, so weep no more as I sang this song about the Commonwealth where the sun shines bright in my bluegrass state of mind. Riverboats from the Osborns to the Goins, barbecue